According to the Kaiser Family Foundation, 1 in 4 Americans report trouble paying for their prescription drugs, and that they or a family member have not filled a prescription, have cut their pills in half, or skipped doses altogether due to costs. Well, that sounds like a big problem. And you know what? A lot of Americans realize that. A recent Harvard political poll in January found that 80% of Americans think that lower prescription drug prices should be the top priority of Congress.
Wow.
I know. That's surprising, right?
But I can understand why.
Well, I can too with this sort of research. So joining us today in studio is Lee Purvis. She's the Director of Health Service Research at AARP's Public Policy Institute. Lee, thank you for joining us.
Thank you so much for having me.
Before we get into the research and why we brought you here, why don't you tell us a little bit about yourself and how you came to be at AARP and what you do for them?
So I am actually a tried and true local, which not many people can say here in D.C. I grew up in Springfield, Virginia, and so politics were kind of in the water. And I happened to find myself kind of interested in policy, kind of interested in health policy. Long story short, I started working on prescription drug stuff, and here I am.
Proud graduate of the University of Mary Washington.
I am.
Which is a lovely little school in Fredericksburg.
It is, and I also went to George Mason, which is in Fairfax. Like I said, tried and true local. Didn't get far, but given what I do, this is probably the only place I can really do it.
That's true.
Oh, so I guess you were just kind of a glutton for punishment if you wanted to get into healthcare policy. Maybe all policy is hard and difficult.
I think it's safe to say that. But lately, healthcare policy has been particularly punishing. Yes.
It
has been somewhat controversial, hasn't it, over the last several years.
So I think there's obviously a lot of reasons why we are dealing with this rising cost in prescription drugs. It's very complicated. There are a lot of opportunities to get outraged. But I think what really gets Americans upset the most is knowing that people in other countries pay so much less. Like apparently in the U.S., for the world's top 20 selling medicines are on average 3 times higher than in Britain. Like, oh man, people in the UK are paying so much less for drugs.
And the exact same drugs. That's the other thing that people really need to understand, is it is literally the exact same product, but they're paying substantially less for it.
All right, so let's try to unpack this, because this is obviously not going to be very easy, but let's talk about how this system works in America. Okay, let's say I'm a drug company. I got my drug approved. It's a great drug. FDA, I guess, is like, okay, yeah, cool. Now you get to sell it. And then I just start selling it? Is it that easy? It's like it's that easy.
It is. You put it on the market, and then the next question is who's going to cover it and how they're going to cover it. And our healthcare system, as you probably know, is remarkably complicated. So there are some programs like Medicaid that pretty much have to cover it. And then there is private coverage where they actually kind of make decisions about which drugs they cover. So you may see some people paying more than others. You may see people with different cost sharing. But the reality is in the U.S. system, generally, once you get a drug on the market, it is going to be covered.
Okay, so then what happens in other countries? I'm a drug company. My drug works. I'm ready to sell it. Hey, Denmark, here's my drug. So actually, let me not name countries specifically. Let's just unnamed country.
Unnamed country is not
drug.
here.
Yeah.
Yes. There are a few more steps before you actually have the drug on the market. So some countries will take a look at the new product and compare it to existing products and see whether it's better. Some may look at the efficacy of the drug and say, you know what, this price just does not work for what this drug actually offers. So there's some decisions made at that very high level before they decide whether and how to cover the drug. And I'm sure you've seen it in the news lately. There are some countries that just said, you know what, we're not going to cover it. And they get some very public fights with the drug company about what's going to happen next. Is the drug company going to drop their price? Are people in that country just not going to have that drug? And again, it's a very public discussion, let's say, that takes place.
Yeah, because drug companies then will come back and say, well, if you're not going to pay these prices for our drugs, then you're going to stifle our ability to innovate, because we're going to take all this profit and we're going to put it back into our business, and we're going to make better innovations to make your life better. And if you're not going to buy our drug at our prices, you're stifling innovation, right? Is that like the main argument that drug companies make?
Pretty much, yeah. It is an argument that if you don't give us what we want, then you will not have drugs to cure the things that you want to cure. There are a lot of questions about the validity of that argument. For example, if you look at all the patents that have been given out over the past several years, 75% of them are for things that already existed in the drug space. So they're for recycling, repurposing existing drugs. I'm not sure we really qualify that as innovation under a normal definition. So sometimes it's good to kind of push them as to what they actually mean by innovation, because if we're just getting kind of recycled products, we're not getting a whole lot for that, and we're being asked to pay a lot for them.
Yeah, and here in the U.S., I read an article that was basically saying, in the U.S., we spend so much more on these drugs than other countries that we are essentially, as a country, subsidizing the whole industry worldwide. How true is that?
We are definitely spending a lot more on the same products. We have a lot more people using them too, but the reality is we're paying much higher prices. What's fascinating is that drug companies have admitted that they are still making a profit in those other countries, which means our prices could come down and they would still be making a profit here. So they really are, at least the term that's often used is profiteering here, where they're just making so much money. And the question is really, is it justified?
Yeah, it's an interesting question, right? Because we here at the Motley Fool are investors. So when we buy a stock, we are partial owners of that company, and we want them to be profitable. We want them to make money, and we appreciate innovation and all that. On the other hand, we also believe that generally we'd like our portfolio to reflect our values, and we think that our company should be doing good for the world. And there is no question that the pharmaceutical industry is among the most profitable in the world.
They absolutely are. There is a lot of money swirling around in that particular part of the market. And I think the question really rises when you're talking about people's health. There's profits coming at the expense of people's health. And that is really where organizations like AARP get engaged, in the sense that we're seeing so much money flowing to the companies. At the same time, we're hearing from our members that they can't access the drugs that they need. And that obviously is a huge problem.
Yeah, it's almost kind of like other countries treat drugs as a utility, and medicine as a utility, as opposed to a profit center or companies that should be making a lot of profit.
Yeah, and the drug companies are behaving completely rationally in the sense of the incentives that we put in before them. They will and can make a whole lot of money by pricing their products incredibly high. But again, the question is, are these things that people have a right to access to maintain their health? And that's the questions that are really being raised now.
We're one of the few podcasts that would be like, but what about the shareholders? Because I was reading an article. It was about, a pharma executive for Nostrum Laboratories. He defended his decision to raise the price of an antibiotic to more than $2,000. It was a 404% increase, arguing that there is a moral requirement to sell the product at the highest price. And it's been a drug that's been around since like the 50s to treat bladder infections. But anyway, he doubled down on this unpopular opinion by siding with Martin Shkreli, the guy who famously raised the price of an AIDS and cancer drug from $13 to $750 per tablet because, and this is again this guy from Nostrum Laboratories saying he had to reward his shareholders. I'm so torn by that as an investor, and that's also the case that you see in other places. I was reading lots of articles, and I kept stumbling upon this guy that I used to work with, Craig Garthwaite. He's in a lot of these articles. I assume you're familiar with him and probably run into him all the time. He's usually on the side of business, but his whole argument was that a venture capitalist is going to want to invest in something that's going to be more profitable. So if a pharmaceutical company isn't going to be profitable, then they're not going to get the money to invest. And then again, it's back to that. Then we aren't going to have innovations, and then everyone dies. So, it's true. And sadly, it's true. But anyway, I don't know what the balance is supposed to be between profit and doing good in the world. So let's maybe move on to talking about what are some of the policy solutions that are getting thrown around out there.
So there are a ton of ideas floating around. Some of the more popular ones are things like secretarial negotiation, which is allowing Medicare to negotiate. Right now, it doesn't negotiate prescription drug prices, which seems a little interesting given that there are, 40 plus million people in Medicare Part D. There are 50 some million in Medicare broadly. It's a lot of people. And the fact that Medicare doesn't negotiate on behalf of its beneficiaries seems a little strange. We're also hearing a lot of talk about importation, which going back to talking about how other countries pay so much less. There's talk of either importing the drugs and paying the lower prices from those other countries, or in some ways kind of importing the price and not the product and just saying we're going to reference price and base our prices on the prices of other countries. We're also hearing some things that we really didn't talk about even, a few years ago, things like jumping into the patent system and reforming how patents are handed out, or changing the type of exclusivity that drug companies get when they first come on the market, really just kind of playing with how much time they get a monopoly period. There are some concerns that those monopoly periods are being abused, for lack of a better way of putting it. And so trying to find a way to kind of limit the amount of time that brand name drug companies can stay on the market and charge monopoly prices.
And what's your opinion? Like, what do you think is the best possible solution, right? It's so easy.
It's so easy. The things that we are particularly focused on are ones that would really maximize competition in the market. So making sure that generics enter the market as quickly as possible, because that really is when you start seeing some price reductions for the generics that are competing on price. We're also very interested in Medicare negotiation. We obviously represent that demographic, and we want to make sure that Medicare beneficiaries have access to the drugs that they need, and also make sure that the Medicare program spending doesn't get completely out of control, which unfortunately is what we're seeing right now. We're also interested under Medicare in an out-of-pocket cap. Right now, Medicare Part D, which are the private plans that cover drugs that you pick up at the pharmacy, there is a cap, but it's not a hard cap. So you actually continue paying even after you enter catastrophic. And we have some people who are paying $10,000 a year for their prescription drugs. And we always like to point out Medicare beneficiary median income is just over $26,000 per year. So you're talking about spending that nobody can really keep up with, much less someone with a relatively limited income. So a lot of ideas on the table, and we are certainly interested in, whoever's bringing something forward to take a look at it.
Yeah.
What about a situation where a company, has the patent on the drug? They come out, they're the only folks providing this, so there really is no competition. And even if Medicare or anyone else could negotiate, they'd say, fine, who else are you going to turn to? And some of those drugs, in one article, tens of thousands of dollars a year, up to $1 million a year, depending on the drug.
Yes, and that is where it gets complicated, because you don't want to disincentivize companies from coming up with those types of cures. We want those innovative cures. So there is a very fine balance between maintaining the innovation and making sure those products are affordable. Something a lot of people are interested in is just looking at the prices generally. So when you have that single source drug come on the market, have some idea as to whether or not the price is justified. Because right now it seems like all of these companies come on the market with prices that seem to kind of balance between maximizing profit and making everyone very upset. And unfortunately, that's what has happened. And so, even you were just talking about the drugs that are, $2.1 million is the new high watermark. Back in the 90s, drugs that cost $10,000 were unthinkable. And now we're, again, over $1 million. So we really have kind of seen some movement in what we consider outrageous. And we've never really stopped to think about whether or not those prices were justified in the first place. So there's a lot of interest in trying to kind of get behind the curtain and say, okay, how much did you spend developing this drug? How much does it actually cost to bring this thing to the market? Because right now we don't know. And then start having a conversation of how much value it brings to the patients who are using it, and then think about the price, as opposed to just building on what may be a very broken pricing model that we have right now.
We're talking about things like Medicare and the government and the role of pricing. What's the government's role in innovation? I don't know the answer to this, but how many drugs are developed by the government, whether at NIH or at universities with government grants?
That is a great question. And a lot of people don't know this. All of the drugs, the innovative drugs that have been coming on the market lately, have their origins in taxpayer-funded research. So they play a very outsized role in kind of developing those compounds that are ultimately developed into drugs. Drug companies will take them from that point forward and go through the clinical trial process and the FDA approval process. But that basic science is really being funded by taxpayers, which means or makes paying these high prices that much more, let's say, unjustified, I think, for the people, because they've already paid once and now they're paying these remarkably high prices later.
All right, so I'm a fairly young, healthy person, thankfully, knock on desk, which
Formica, maybe?
Formica, I don't know what this is. But so prescription drug costs aren't really on my mind, but it's probably in my best interest to anticipate that this is going to be a pretty big cost center in my retirement potentially. So what can people my age do, if anything, to prepare or anticipate how this is going to impact me in the future?
Well, I think the first thing I want to make kind of clear, because this is something we think is really important to convey to people, is that even if you are young and healthy, you are already paying for prescription drugs. You're either paying for it at the pharmacy counter if you are taking a drug, or you're paying for it through your health insurance premiums, or your cost sharing, what your deductible looks like. All of that is driven by what the plan is paying for prescription drugs. And then, of course, you presumably pay taxes. So your taxes are going towards prescription drugs as well. So the thing we really like to drive home is that prescription drug prices and price trends are already affecting you no matter what. So this is an issue that should matter to you regardless of whether you're taking a drug. In terms of preparing, again, you're kind of looking at the trends, and if they just continue unchanged, you will be talking about drugs that on average are tens of thousands of dollars. And a lot of times people take drugs on a chronic basis. So it's not a one-time cost. You're seeing people that are facing these costs every single year for the rest of their lives. So honestly, again, looking at the trends, I don't think you can prepare enough financially for the drug prices that we're seeing right now. Nobody wants to have to make the trade-offs that we're starting to see already, where people are just saying, you know what, I'm going to go without. And we're seeing that with cancer patients. Like, there are people not treating cancer because of the cost. That, again, as the average price goes up, is going to become more and more common. And yes, you cannot have enough money in the bank, frankly, because one story that really struck me was that a public official was out and said, quote, "We're toast if someone manages to cure Alzheimer's. Because if it costs anywhere from $100,000 to $1 million and you've got hundreds of millions of people that could potentially be affected by that condition, that alone could dwarf the amount of money we spend on all prescription drugs right now." So it is kind of scary, frankly, when you think about the fact that you will at some point in your life no longer be earning from a job, and you have to find a way to cover the costs associated with these drugs in perpetuity.
And what about people who are getting closer to retirement and have to start thinking about things like Medicare?
I think the most important thing that any Medicare beneficiary can do is look at their Medicare Part D plan every single year, because they change considerably from year to year in terms of what drugs are covered, how they're covered, whether there's going to be a prior authorization, whether you're going to have some other form of utilization management, what your cost sharing is going to be. Will it be a flat copay? Will it be coinsurance where you pay for a percentage of the drug cost? It really matters. So the one thing I think that people can really do to prepare themselves is get a better idea of what the Medicare Part D plan market looks like, and make sure that whatever drugs you are taking will be covered and covered in a way that makes sense to you once you enter the plan.
I was surprised here at the Motley Fool. We're a pretty savvy bunch of people who I would say are frugal, more on the frugal side than not. And our generic drug usage was actually really, really poor. Isn't that crazy?
Well, I think part of that is people don't think about when they get their prescription from their doctor, nurse practitioner, and they don't really question it. And they don't say, oh, is there a generic version of this? They just like, oh, this must be the right one for me.
Yeah.
And then what you do is you go to the closest pharmacy, not appreciating the fact that actually prices do vary. And that's one of the things anyone can do is check the prices in your area. Where are you going to get the best deal?
Absolutely. The number one thing that you should be doing with your healthcare provider is having an open conversation about all of the drugs that you are on. There's a pretty good chance that either there's a generic or something that may be less expensive. You just need to have those conversations. You can have it at the doctor's office, or you can have it with your pharmacist as well. But that is incredibly important, and probably the easiest way to get some savings is to find out what else might be available to treat your condition. And then, like you said, there can be some great variation in terms of what pharmacies are charging for a given drug. So if you're in a position where you are paying full price for the drug, it can definitely make sense to go and look around and see where you can get it for the lowest price. That said, if you have cost sharing, you also may be running into something else we've been seeing a lot lately, which is your payer may have a preferred pharmacy where your cost sharing is lower than it would be if you went to a non-preferred pharmacy. So lots of different things to keep an eye on in terms of reducing your out-of-pocket costs.
So a couple of the websites that I found in my research that will help you determine the prices in your area where to get a good deal are GoodRx, WeRx, Blink Health, and RX Saver. And I've not personally used any of these, but I learned about GoodRx from Seth Jason, our colleague who's been on the show. And he uses it for his dog because his dog takes, and that's something that's become increasingly, I don't know if the word's popular, but people are using more and more pharmaceuticals for the dog. So you can get discounts at all these places. It basically says how much this drug will cost at various places in your zip code, but also might offer up a coupon. In some cases, paying cash with the coupon is going to be a better deal than using your insurance.
Absolutely. Yes. It pays to shop around. You have to be savvy about this. There are a lot of different moving parts in this particular part of the world between cost sharing and the price and coupons. And is there a generic available? Is there a therapeutic equivalent available? There are a lot of different things to keep an eye on, which is why it's important to talk to your healthcare provider to make sure that you are hopefully getting the lowest cost option available.
Yeah, my dad recently was complaining to his doctor about how much his prescription was costing. And so what they did is they applied directly to the manufacturer.
Yes.
They did the first paperwork, then they sent my dad some paperwork. He had to fill in some more paperwork, and he got a huge discount.
Yes, the manufacturers do have programs that help patients who can meet their eligibility criteria. Word to the wise on that one, though, is there's a lot of variation in terms of what the eligibility criteria are, and it can be a complicated process. But we've found some manufacturers for which the eligibility criteria are different from drug to drug. So it can be a complicated, difficult process to get through. But if it's the difference between you being able to take the drugs you need and not, it is definitely a good option.
A couple other common tips that people will hear is paying for 90 days instead of 30 days, you'll often get a discount, or buying something like 20 milligrams if you only need to take 10, and then you cut them in half with the scoring. That always sounded a little dicey to me, but so I'm curious your take on the whole cutting your pills in half.
Yeah, that's something that's a little outdated in terms of the advice. I think people are kind of moving away from that because there is so much potential for human error, and you really don't want to take chances with that. So our recommendations typically fall along the lines of talking to your healthcare provider, check out some programs that are available for people who have lower incomes, kind of things to push you towards someone who can help you kind of navigate the system a little bit better.
So some of what you're suggesting is basically the policy issues, right? So where do people go to find out how to be involved with that and to encourage their congresspersons to take some action on that?
So there are a lot of groups that are heavily engaged on this issue right now, a lot of consumer-focused groups. You, of course, can also go to AARP. We're actually engaged in a campaign we just launched in March called Stop RX Greed, and have a whole part of our website that's completely devoted to this issue and trying to push forth policy options that we support, and that's at aarp.org/rx. But again, this is kind of an issue that's resonated with a lot of different groups. Another is Patients for Affordable Drugs. They've been heavily engaged on this as well. And we're also involved in the Campaign for Sustainable Drug Pricing, which also is heavily engaged. So there's a lot of different groups out there. I think, honestly, you could just open the paper and you could get a good idea of who's involved. But it's definitely an issue that's resonating with a lot of consumers these days.
So I'm reading the Kaiser Family Foundation also did a survey asking what people felt they were most in favor of to keep prescription costs down. And one of them is ending the tax break given to drug companies for their advertising spend.
Yes.
Now I'm angry all over again. This is like 12B1 fees, but for prescription drugs. What is that about?
And we are one of 2 countries that even allow that type of advertising to take place. But yes, that is definitely an option that has been on the table. You know, why should drug companies get a tax break for advertising to consumers and potentially pushing them to take drugs that they don't need? So yes, that is.
Oh man, that makes me almost more mad than how much England is paying for drugs. All right. Well, do you have any parting advice for our listeners as we wind down here?
No, I think just the most important thing is when you are prescribed an expensive drug, you do have options. You just need to have an open conversation with your healthcare provider. And if you really want to do something about it, you know, come look at AARP's website, join our campaign. We are welcoming all takers and are very interested in making sure that this is an issue that is addressed soon.
All right. And that website again is
aarp.org/rx.
Wonderful.